And welcome to FYRSYD Conversations, ladies and gentlemen. Today we are talking about sexually transmitted infections. We've got guests from the Department of Health, Matlosana Sub-District, which falls under Dr. Kenneth Kaunda. Our first guest is Mr. Thomas Todi. How are you doing, sir?
I'm good, and you, Mr. Mantandlovu?
No, I'm very good. Osinswaki Moatwi. How are you doing, my sister? No, I'm very well. And then on my right here, we've got Os Itumeleng Ntseki.
Hello.
The guy who's like, you're right. Hello. Okay, let's just get straight into it. STIs, Mr. Todi. What are the different kinds of sexually transmitted infections, and how is it that people can identify them? Should they fall into the trap of being infected?
Okay. In terms of sexually transmitted infections, Mr. Mantandlovu, let me first take this opportunity to thank you for giving Department of Health this platform. Yes, February is STI month, so I hope that this is the reason why we are here, and then that will deliver the message. So in terms of the types of STIs or sexually transmitted infections, we are having different types. I'll just mention one or two, and then Mamwatsu here will also add to what I'm going to say. We are having gonorrhea, which is the other type of sexually transmitted infections. We are having male urethritis syndrome, MUS, and then we are having the syndromes, which are vaginal syndromes for women. In terms of treatment and identification, we are having different signs and symptoms for STIs. First of all, they will feel low abdominal pains. They will present with low abdominal pains. They will present with burning micturition or urine. They will also present with vaginal discharges or penile discharges, and then also some pains, discomfort from their private parts. That are some of the signs and symptoms of sexually transmitted infections. Mamwatsi will also add some which I did not mention, and also some of the types that I did not mention.
Okay. The other type of STI, renal syphilis, renal like amoto arota, moroto bochesa, renally, both male and female vaginal discharge, and then the treatment, since what Mr. Todi said, are the same. It's only depend on what is the sign and symptoms.
Okay. And one thing that I wanted to find out as well is when people are experiencing such, right? I don't. Any of you can take the question.
Okay.
When they're experiencing any of the symptoms that you just mentioned, what is it that they can do in order to seek assistance, to get help?
To get help, firstly, what are we doing? We are doing STI screening. We've got a form. That form is going to lead down the problem in the STIs because STI screening, some people so screening se khona go create education gore ba khone ba re arabe, and then ke mo re tlo go tlhaloganya gore bothata ke bo bofeng mo di STIs re nang le tsona.
Okay.
Yeah. And I think also if they start experiencing some of the symptoms that we've spoken about, they can go to the nearest clinic. If they go to the nearest clinic, that's when they will then get help, and that's when the screening will be done. So I think the best thing would be to present yourself to the nearest clinic so that you can actually get help.
Okay. No, all good and well. Now, getting back, because I think that we just went a bit forward. How is it that these ailments can be spread amongst people? How do they spread?
Through sexual intercourse. Sometimes you can get it into the toilet, especially the woman.
Okay.
Yeah. if maybe somebody anale infection a baya toilet, maybe as I pumula or I can't remember me raise our part is inside. So sometimes I do la mo toilet e khona go swara ena e go tsura le motho a me wa gutla onale frequent moroto no and then oya toilet or sometimes o tlo ke to onale di abdominal pain ke the most in gore di kry during intercourse or go toilet is yo.
All right. Okay. Yeah, as we said already, they largely spread through sexual intercourse and then also, getting in touch with certain surfaces like your toilet bowl and whatnot. Mr. Turi, as a physician, is it possible for a mother or a pregnant woman to infect their child with an STI? Whether it's during birth or while they're still pregnant?
The unborn child, yes, the infection can be transmitted to the newborn. That is why after delivery, we immediately apply a certain eye ointment to their eyes to prevent, because sometimes they will be born with that infections. If the mother had the infection and the mother was not treated, and then there is that possibility that the newborn can be born with that, and it is called syphilis. We'll give them eye ointment immediately after delivery to prevent the complications. So yes, it is true. It can be transmitted to the unborn or the newborns. Okay.
And what advice would you give new mothers or pregnant ladies in terms of how they can avoid to infect the unborn babies or the newborns?
To use condom, stick to one partner. Like they're already pregnant, we can say abstain. Yeah. You rather say use condom, stick to your partner.
Yeah, but now if you are saying condom and stick to a partner, I guess she fell pregnant because the condom was not being used.
But to prevent.
But again, I think
she's pregnant, already pregnant.
But we are preventing STI.
Right.
And if you already have the STI, get treatment.
Yeah,
if you're pregnant and you already have the STI, get treatment. I think that would be the most critical thing. Get treatment.
That is very important to get treatment. And transmission, Mr. Ndlovu, it's not about having sexual intercourse.
Yeah.
We have to qualify it to say unprotected sexual intercourse.
Mm-hmm. Yes.
Because if you are using condom, obviously you can't contract STIs. So you must be clear to say unprotected sexual intercourse.
Okay.
And multiple partners.
Yeah. All right. No, that's fine. Now, I just want to get into the long-term effects of untreated STIs. What are the long-term effects? What is it that people can expect to live with if they are not going to go and treat their ailments?
Yeah, obviously in terms of the complications of untreated STIs, number one, infertility.
Mm-hmm.
Infertility. That is because STI can end up affecting the fallopian tubes.
Okay.
Fallopian tubes.
Yes.
So that where you are going to have a long-term effect of it, infertility, and then other complications. And the worst complication will lead to, or will be death. Because they can die also. And then even before death, you are having more HIV, that you can also contract HIV through unprotected sexual intercourse. If the person is infected with HIV or is having HIV and is not on treatment or is not virally suppressed, that person can end up transmitting HIV to others if not treated.
Okay. Yeah. I just want to get into the awareness campaigns that you will be running throughout the month of February. What would you say is the core message that you want to relay to the public at large?
Firstly, we give health education on STI, and then we contribute the condoms. We are doing the STI screening, and then and we encourage people to have one partner or to abstain, to be faithful. Since well we know gore STI is very dangerous. And then when we look our stats, Matlosana really there is a lot that is not doing well in Matlosana.
So would you say, Ostumi, is that what would be the contributing factor to people in Matlosana having a high rate of or high prevalence of STIs?
I think one of the contributing factors would be lack of education.
Okay.
I think also sometimes we tend to be ignorant. We know about condoms, we know they are there, but we don't want to use it because of our myths. We've got different myths. If I use it, this will happen, or it does this to me, or things like that. So I think that's one of the other contributing factor. And also, and also even now amongst the young people, our teens now, they are sexually active, and most of them will have multiple partners. And peer pressure, where you find young people now, because this one is doing it, we all have to do it. So those are some of the contributing factors that you find that are contributing to us having a high rate of STIs.
Okay.
But I think most importantly now, lack of information on STIs, and especially young people, we tend to believe what we are told by our peers. It's going to be difficult for me to listen to Memo Atwi advising me, but I'd rather listen to my friend. And my friend will obviously give me information which is not correct. And I end up not doing the right thing. And then I pass on the STI to other people, and it becomes a vicious circle because we are not getting the correct information.
6 days of separation, yeah?
And the other thing, poverty. I can't say income ke feel ke na le multiple partners, and then unemployment ke sebetse so wazama, and sometimes they were the breadwinner ko tlong. So gore ne le income tshwantse o taboge o bone gore bontate mandla bontate tudi ba tla nthusa jwa.
It's that thing ya gore o kwa airtime
like she's saying, our unemployment rate is very high, ne?
Yeah.
So these the adolescents and young women, they end up being involved in body substance abuses, including alcohol. When you are drunk, you cannot make a sound decision on whether to use the condom or not to use the condom. So I think that one also, substance abuse contribute, and unemployment. Or they cannot advocate for condom use. These women, it's the guy who's supposed to say condom or no condom.
Okay.
Because I agree, are depending on him.
But then
depending on him,
yeah.
So it is difficult
to say no.
To say no to him.
I mean, what would the consequences be? I mean, if you were to say no.
You lose the benefits. He's going to lose the benefits.
Yeah, the benefits.
So what you are saying to me is that these guys actually demand sex without protection.
Yes.
Because they are providing
95%.
whatever little bit that they are providing.
They are providing those. They are the ones buying.
And they make the rules.
Now we spoke about lack of information, not filtering to the people. And then now we've got this information that, guys demand, sex without protection and so on. So if we have the means to communicate the information to the very same guys, where are we going wrong in terms of, drilling the message home?
I don't think we can say they are demanding sex without a condom in laws. They are not saying anything about the condoms. I don't know initiate or no, let's use the condom. The guy will be quiet, and this one will depend on the guy. So if the guy is not saying anything about the condom, to say no, you cannot have sex without the condom. Because of the benefits that we are.
All right. So now if the young lady was to say, okay, fine, let's use a condom. I get everybody admits no one is initiating the use of protection. So if the lady was to initiate that conversation, what would happen? Maybe the lady is not going to initiate or use a condom, but the provider, I don't know. Yeah. So yeah, the question is.
The question is, they don't believe on condom. They don't.
Yeah, but I think we must be specific. I don't know about circumcision ordinarily go to hospital and everything like that, and there are people who go for. Yes. Okay. So would you say it's all of them, or is it just specific people who come with their agendas, or
both?
You know?
According to me, both.
All right.
Because circumcision, there's nothing give them myth yabona. Both tabale medical. Few they understand, but majority they don't understand, and they don't want to understand.
Okay.
So that is where awareness campaigns comes in, to say we have to promote body condom and provide, not only to promote them, but also to provide them the education to say use the condom, protect yourself to prevent STIs. And we tell them to say STI is not only about body gonorrhea and stuff, it's about body STI also. And it's about HIV also.
Okay.
It's about unwanted pregnancies also. So
and we need to teach our males that circumcision is not prevention.
Yeah.
Because then most of them believe the moment you circumcised, then you can prevent these STIs but it's not prevention.
Okay.
You still need to use protection even if you're circumcised. I think we need to teach our males a lot on
so
that.
It's about awareness.
Re-emphasize it a lot.
Now, coming back to that whole circumcision thing, you'll find that in some pamphlets that are distributed, it says that when you have circumcised, it lessens, doesn't prevent. It lessens, the potential of being infected with STIs. What do you have to say about that?
That is true.
Okay.
Yeah, that is true. Circumcisions does in a way prevent or minimize the risk of contracting HIV and AIDS and also STIs. Remember, circumcisions we are talking about partially or total removal of the foreskin. And the foreskin is no problem. If you are having the foreskin, it means during sexual intercourse, there is that possibility for the foreskin to crack. And once it cracks, it creates the entry point for HIV and other STIs. So if you have circumcised or removed the foreskin, there won't be that risk of cracking. Remember, HIV needs
an entry point.
Yeah. So once you have a cut or once you have STIs, that's the entry pointer for HIV.
Okay.
So it is true that circumcisions reduce the risk of HIV transmissions.
Okay.
Emphasis on reduce doesn't totally prevent it.
It doesn't
just
prevent
reduces
it, hence the use of condom.
Okay. No, great stuff. Let's just take a bit of a break and then we can continue from there.
All right.
All right. As we were discussing the whole issue of communication between partners and safety measures to avoid sexually transmitted infections, what would you say is the best way to, should people contract STIs, and they go to visit a clinic and so on? What are the ways that they are advised or tools given to them that they can use to actually deal with all the infections?
Okay, obviously, if you are having the signs and symptoms or you feel or you might be having a STI, the first thing is to go to the nearest clinic to consult, to seek help. After the clinic, they will obviously screen you for STI symptoms and signs. And then if you are presenting with the signs and symptoms of STI, you'll be given a treatment, not only treatment and health education also, and what to do to avoid the recurrence. And then what is more important is partner testing also or treating. must be the partner. Usually when they come to the facility, present with STIs, we'll give them treatment and then we'll give them contact slips to bring their partners.
Okay.
Partner or partners. Because it happened or you are having STI.
More than one.
You're having 10, 15, 20 partners.
No, but it's true.
It's true.
So we are going to give you 10 contact slips.
Yeah.
But before
For your
contact
partners to prevent recurrence, because sometimes you took medication, but the partner did not get treatment. That's the problem.
But before you go,
Yes.
since it's similar health education, Tate Matla, go have treatment or as long as we see information, how can I solve? So it's similar health education. The first.
And I think also the importance of why you must bring your
Yes.
partner.
Yeah.
Because if you just tell a person to only partner, yeah,
No, that is true.
But they don't go, they don't disclose to their partners, and the partners end up now not getting treatment because the other partner is quiet.
Okay.
And they're not also clinicking or created the right treatment. So we need to educate them on the importance of bringing your partner along.
And it's about because of how the me wa mutlu na kero re ntate mutlu. This is saba go bua, this is saba go tsa partner. We say re mo khauti.
And not only giving treatment Matlosana to the patient, you also test for HIV.
Yeah.
Because if you're having STI, it means you are at risk. You are
certainly.
indulging in unprotected sexual intercourse. So we also exclude HIV by testing. And then if you are having HIV, obviously you'll be given post-test counseling and ARVs.
And
Mr.
I
Tori.
find treatment development.
Take over.
Before treatment, the treatment is a condom. You emphasize a condom both
Yeah, I'm talking
male
about
and
condom.
female.
Yeah.
Keep doing a total
Male and female condom.
Now, one thing, since we work at the condom and everything like that, I have noticed that male condoms are largely distributed. You know, you go to different places in the bathrooms, you'll find male condoms and whatnot. Even body countering when you're going to body tavern and so on, right? Not to say body tavern, but anyway.
No.
Yeah, but then what is it that makes the free distribution of female condoms a problem?
Okay, zabon me radinta. Problem ya bo me special. Me kre obvious o special. Le condom ba gamme is special.
All right.
Condom ba gamme a o itsingela o emela ka te bontate ba dira ntate o khona go potela ba tla itsintse. Me na le method how do you insert female condom. That is why sometimes I read the bele ba sadisi di immereko. Wa itse me mmereko wa makeup o dirang. Female condom is something like this.
So, Mr. Tori, I'm sorry to say this, but it's like loud in your condom, you need foreplay and whatnot. Eh?
No. And I want to I have body baby whatever. Yeah, make you 8 hours. I can insert it 8 hours before. And I want to guarantee she.
So determining fast fella so
determining ina le matsapa ina le action ha itsingwe hela I cheap into.
Oh, so basically one of the biggest concerns go immereko. And that's why it's not popular.
Popular but
ya no khanya gore dira modumo ntshwakana if I bontate ba le bantsi ba rene bone I khona ga ba batla dira modumo e dirang but maybe it's just a myth.
Yeah, give me ya gona ntwe ya gona condom mona taka bomme.
O utlwile
Ha bonate.
Spoken from experience.
Yes. Yeah. But
Nice.
yeah, it's true Mr. Ndlovu must also promote female condoms.
Yeah.
But to tell the truth, male condom is the one moving if you compare to female condom distribution. So we need to encourage people to use also the female condom.
Okay.
It is available all over. They are available. It's just that we need awareness creation in terms of the usage of female condoms.
And you know monate ina le di flavor like ya bontate ina le bo caramel. Originally.
Thank you. No, it's fine. Now, speaking of ways of prevention and treatments and whatnot, now one of the acronym it's PrEP, it's PEP, and it's ART. You can decide which one you start with. Any of you. You know what? In fact, it's in sequence. let's say somebody was exposed because they were attacked. You know, we do have a problem, rape, which is quite high in our country. And somebody forced themselves onto a woman or a man, because it happens either way. So what are the steps to be taken? Because now you've been exposed and most rapists don't use protection.
Okay. So I think we are talking about PEP.
Okay.
Post-exposure prophylaxis. That is what it's called. So post-exposure prophylaxis is after you have been exposed, like you rightfully said, where maybe condom burst or you were sexually assaulted, stuff like that. So when you get to the facility, you'll tell them that you have been exposed and then to HIV. You have been exposed. So what they are going to do, they are going to give you HIV medication. This one is different from ART. It is different from PrEP. You'll be given medication. It's not a lifelong. It's a 28 days course where you are going to be given medication. But importantly, before you are given medication, you have been exposed.
Yes.
Maybe condom burst or you have been sexually assaulted, rape or what. The first thing is to test you first. Or no, how na yon HIV.
Okay.
Before a car no, you have been exposed to PEP. Ra test a pele go bona gore no o HIV negative, because it's no use for HIV positive gona PEP. So after it's not test, if you test negative, that's where we are going to give you post-exposure prophylaxis for 28 days. So obviously we're going to do pre-counseling and then also post-test counseling, and then give you the medication for 28 days. And then after 28 days, you are going to be tested again. And then during PEP, during those 28 days, we are going to encourage you to use condoms, make sure that you prevent STIs, you prevent HIV within that 28 days, because it doesn't help around 28 days in PrEP, but at the same time having unprotected sexual intercourse. That is very important. And then maybe you are testing positive, then that is something else. It means HIV. So it means something else. It's no longer PEP.
And then Mr. T, don't forget, the hours is already check how many hours.
That's true. Yeah, PEP must be given within 72 hours. Okay. That is 3 days. Must be given PEP. After 72 hours, it won't help. It is effective if you are given within 72 hours. Yeah, I was saying, how do tester then will test HIV positive? So it's no longer PrEP. It's no longer PEP. I mean, it's something else. It's art. But in terms of post-exposure prophylaxis, it's 28 days. It must be given within 72 hours to be effective. That's to prevent HIV if you have been exposed. We are talking about PrEP, PEP.
PEP. Okay. Now, without getting into the numbers and everything like that, how effective would you say PEP is when it comes to assisting those who have been exposed, if they take it in time and according to the manner in which they're supposed to take it?
It is very effective. Remember, PEP, it's HIV medication. It's the very same medication that we give to HIV positive people. So, but this one, because you don't have, we are preventing, hence 28 days. So it is very effective as long as you came or it was given within 72 hours.
Okay. As
long as it was given within 72 hours, and as long as you are going to take those preventative measures during the 28 days, during PEP, body condom use, and then making sure that you are not exposed to any unprotected sexual intercourse. You are taking the medication daily as prescribed by the clinicians at the clinics.
And how we told for plus minus 7 days, since na kwa gago ine the same. How we nwaka 8. We nwaka 8 at least. How to face 7 days yone in the street na ku A1. I come mutla ba lebetse like at ke re khona ra we gopola khona go eno. Mara this one gore khone e sebetse mo melong wa gago e fa 7 days strictly kana ku e latelana.
The first 7 days.
Yeah, but I re-encourage just if something can happen.
All right.
But when about 7 days.
Now let's talk about, because you mentioned art. When somebody has been exposed, you assist them within 72 hours, bakra, PEP and everything. And then if you test them and they test positive, you said that, they're given a different treatment. And you said art. Okay, can you get into that?
Yeah, that's true. So art is different to PEP. Art is a lifelong. You are on lifelong ARVs, so what would you know until. Daily, like she's saying, most of them or most of us, once I got una pilisa, once I got una pilisa, we should have lifelong, lifelong. This one. So PEP between 8 days and then art is lifelong, lifelong antiretroviral therapy.
Okay.
And then that's where we are going to give you medication, and then every year you'll be tested body CD4 count. You'll also be tested body viral load to see if you are taking your medication well. Obviously, if you are taking your medication well, your viral load will be suppressed.
Okay.
If you are not taking, you will be having body viral load body million or body thousands. Then we will know how to treatment to know.
Okay. And then what effect does it have on a person who has had no treatment?
Yeah, it's very dangerous because if you are not taking treatment, it means you can still transmit.
Because they start and then they stop and they start. And they
it's
stop.
the problem. It means you are
process.
still going to remember if virus is detectable in your system, it means you can still transmit HIV. But if it is not detectable, it means you cannot. It means you are compliant on your treatment. But now, outside say we not stop, happy can be resistant to medication. But they are in the long run, okay, no, una fela but hadisa bereka yana. Okay. Una fela hadisa bereka mo system ya gago. So it's very important also with every visit go clinic go dire body adherence counseling. Re ntse check la gore motho a compliant or yat. O sa go social screening re check gore ga le mathatanyana o tlhoka support nyana go ka thusiwa gore go na medication. A ke ba bang kre motho a sa le treatment ya la rena ya ke bereki.
I can show.
So ra di sheka di otse. Ona le di social worker re dira psychosocial screening go check gore ga tle go support a khone go ja sengonyana before a na pilisi ya gagwe.
Okay. So
ke art eo. Re buile ka PEP and then re buile ka art.
Go shota PrEP.
Tsena mo yo.
Ya ditaro o bua nnete re na le PEP re na le art
le PrEP.
Kolopa PrEP.
Re bua ka shop a kere.
Kolopa PrEP.
Okay, PrEP ke e tla beng o ithola like how to still HIV negative. Re go fa pilisi bitswang PrEP. But Leona, before we told o tlamehile test.
Elore, before we get to the test negative, what could have happened? Or wafela wa ilo tester, why would you be given PrEP? For what reason?
A ke go tla boya go clinic wa tla go testa HIV.
Yes.
So ha fitla go clinic o negative. How le negative ra go educate gore na le that thing ya gore if ile gore batla go dula o le negative. So re na le something se re tla go fan sone which is PrEP. Ra go tlhalosetsa gore PrEP ya a go testile. But officer o testa tshwantse o itlame gore wa go khona go ena for 3 months yona.
Yeah, or more than.
But 3 months after 3 months you came up follow up madi. Go bona gore ame wa tiera ka pa yang. Ha o sa tiere tla go bona ka 3 months gore PrEP ya sebetsa ka pa yang. And then lone go tlatsa mo gona gore batla go nna negative until ne e tswa mo go wena eo.
But the most likely thing gore you want to stay negative.
O tla dula una PrEP.
What
kind of person
okay
would you advocate? Because I'm trying to understand, or you want to stay negative, yes. I can choose to abstain, I can,
Earlier we spoke about STI, ne?
Yes.
We spoke about STI, we spoke about sugar daddies and stuff, or no, ba the unemployed, so ha motho a tla ela a kgola gore ka 16 a di savana ba ya without a condom, they cannot. So PrEP was designed or is designed for what they cannot advocate
For
for
the
condom.
Okay.
They cannot advocate for the condom. So okay, for the high risk
Yes.
PrEP, you give them to the high risk. You can give them to the MSM, men having sex with men, sex workers. They call them the key populations.
Okay.
But when you are married, it means so you are at risk. As a result, HIV if you so hence PrEP. For high risk people.
Okay.
PrEP. So PrEP can prevent.
Okay.
And in PrEP ke tla go shebere it's wa ke batho ba bomme.
It's pre-exposure prophylaxis.
Bontate ba sa ba clinic akere.
Yes.
So na go re ke nne safe akere ke bona Mr. T wa tlola. Wa taboga ko ntle ke bo. So na ke le me ka tla go ipona ke le safe. Ke gona na ke le me ke nwe PrEP.
Ke na bo yala rofo ke tsa maro ke milo se ke tsena go tlunga di a ba se ka botho tloko. Me ga itse go ke tswanteng ga ke tsena mo tlumole ya go tsikinya ke re tlisa. And ga ona ka ra dis condom. Let's use the condom. So ke batho ba lorne they cannot initiate condom. They cannot advocate condom. But they are
So the nice thing about it is
so ke one PrEP and the PrEP mo not think gore one unlike PEP. Unlike PEP. PrEP o gona go yona nako ba tlang go yona ka yona is up to you. O gona go yona o stop o stop go ya ka
As long as only negative.
Yes. Okay. No, that's some important information. Now, the way but baberekisa PrEP ka thing, ne? I'm just playing devil's advocate now. Are there people who engage in unprotected sex, but already are going to rely on PrEP, which means they are just being reckless, knowing already there's PrEP.
Most or some, yes. Because the Department of Health, repartnally shut it now. Shut it now. I think it will partnerly health because of high risk bana ba youth. It's tataka 14 to 24 years. And ebone ba feel Steve Gisa go tsena ko dikolong ba taba tsene inside. Maybe ba ema mo ke bone ba tsamaya ba rufa all around go fa bana PrEP because re bona gore the danger is coming.
Okay. But now, I think that if there's cases like that, there's nothing we can do. Obviously, they need to be given because I feel that to some extent they encourage reckless.
Yeah,
because how some of you happy come shoot or intimile police. Oh, to happy super nagamano.
I think that's where education comes in.
Yeah,
we need to educate people.
Yeah.
Obviously, we offer them HIV counseling.
Counseling, yes.
If they agree to test, we test them. And then our test about negative, and then we will talk about PrEP.
Yeah.
How about PrEP? You are HIV negative, but you protect. How about PrEP?
Okay. Because what I'm looking at now, people barely go PrEP, and then they sleep around, they forget or there's other STIs on which PrEP doesn't work, and then there's pregnancy, the big one.
Exactly.
Because the results of that pregnancy, it's lifelong. When a child is born, you have to, you know what I mean? That's where the education factor comes in.
Exactly.
You were still talking about it. Care to elaborate on that?
Yeah, I was saying we need to educate them. Like you said, it doesn't prevent STIs and it doesn't prevent pregnancy. So these young people, our young generation should know that, yes, they can have PrEP and they won't get HIV, but they can still get STIs and they can still fall pregnant. So we need to educate them that it's not really the best solution for everything.
But solution.
Solution because maybe they're not been told. And I've educated you about the pregnancy part of it. Pregnant, oh my goodness. So I think education, and especially with the young ones, we need to be very strategic in how you educate them. Because that's about how like
Google and that. One mistake
well, let's move on from there because I don't want us to digress. The the side effects? Are there any side effects to all of these medications? Because with anything that you take into your body, there may be side effects, there may not be side effects. Is there anything that you would say people should look out for when they are initiated onto all these preventative measures?
Yeah, that's with every medication. Even Panado is having its own.
Yeah.
They are not too serious.
Panado comes sponsor. Yeah.
Side effects. We call them side effects for the medication they start. Like body nausea. Nausea, body vomiting, body diarrhea. That's when we start. But after a few days, then the body will get used to the medication and will be fine. Yeah, usually it's diarrhea, nausea, and vomiting, and headache. But they are not that serious. Hence we are calling them the side effects.
And it takes only
won't last for
more than 7 days. Yeah. No. I did last time more than 7 days. It means only problem is somewhere.
Okay.
Yeah.
All right.
Yeah.
Oh,
but you don't have serious
side effects
to ARVs at all.
Now let's go to a conversation that you had earlier on. The traditional methods, people seeking alternative medicines. You know that you have fallen ill. You've got the big one, HIV. Yeah.
So, as Department of Health, THP, traditional health practitioner.
Okay.
So, where ha re go fa pilisi bone batla ka moriana ba go encourage gore dinwe di le pedi so ba tsama di training batho bao gona le mekgatlo e leng gore e registered mo health ra ba monitor re ba fa information and then ha bana le problem ba khona go boela go go rona gore ke tswa go ntate duty go 1 2 3 4 ntate duty gore ba leng gore ba registered mo Department of Health re berekisana le bone unless ba leng gore ha ba registered ba tsamedi because a kira ba tswana gona le motlabe a re go health ba go batla chelete whatever wa bona and go health ba batla re berekisa ditlhare tsa rona even mo health rena le di THP wa tlhaloganya that is why go province director bone le THP le party ya bone go rela di traditional di batla o bue re bue re tsenya di meeting re bontshane re ba fa information re na le bona le gore le bona ba ya go community be bana le information re ka se yela bore ha mo fast tarerane ya kere o mo dulise mo fase mo ntse gore a medical wa ga di tlhago tse ba fantsone di testilwe ba rutiwa.
And it helps a lot.
And it helps a lot because default idea fokutsega through THP.
Especially if you believe a lot and you trust the THPs. It helps because then how ya ho bona if they're going to tell you but you need to take your treatment ke motho mo sepileng a kere wa tshepa hore mare these people ntse ba di sebedisang ke a dumela o tsona and they work for me so how a rutue and a gona o encourage wena as a client o tla hore yena hore ke fuwe dipidisi na ba re dinwe. It's going to be easier for you to take it because otlo trust motho he's showing me the right direction.
So you were saying to me
ba bangwe ba khona gore ne like le THP be ke ya go gwena o khona go ene self a go referral to the facility before go fa treatment ya gagwe.
Okay.
Yeah, those
so
who
you
are
saying
registered,
to me
those who are registered, THPs who are registered, they know, they are very knowledgeable. If patient atla go gene a bona gore mo gore they know the signs and symptoms of TB, they know the signs and symptoms of HIV. So gona go bona gore o tshwantswe pele a go clinic ya go test because when they cannot test that so ba gona go bona o tshwantswe a go clinic ya go test for HIV or ya go test for TB.
Also Lebanon they've got an idea of the kind of symptoms.
They get trained
because what is important to me is you are not saying basketball muti di tshwanetse tsa bone tso re bisa gape di pitsana ka
preferably
so ba use di pitsana gore ke tsebetse ba di fe batho bana ba ke tsebetse because re na le dio tsa bo di drug interaction ka gore le gore no pilisi ya ARV e lwana le pitsana enwe ba bangwe STI ba na le tumelela gore no nka ka hela go THP and no tla treata ka fola ga tlo go fola completely ko morago o tlo go tla go clinic kgotsa o tlo go complicate and then previously ba ne ba shwa kare mara no ha rena le bothata ja gore no tshimolla ko kwa
ne bana le
tla le go tleliniki ya le gore di kopantshe mara se kana khanya gore fela mo dipitsaneng and then ga o tle go tleliniki
ene batho rena kre bana le dimith ba tla bolela gore dipilisi di a diga mara wa pitsana wa emisa
ena re batle go wa
ena kana mo se batlang
se go tse sa di gare se ba 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 bolela monna di bad news mo lela ka go diga ba tlolo mo so ya ke ona khanyo ya gore no re batla fela tse di positive but mo department means just like I work traditional health practitioners they are registered MEC banal di meeting le bone they are knowledgeable ba sa di training so we don't have a problem in terms of that le batho ba sa tlhokagala ka ntlha bo di STI because our THPs are
on board.
They are on board.
So you encourage people or aba visit the THP, right? Aba visit the THP. They must be open. The status it's about and what.
Yes.
Yeah, because essentially it will work in their favor. Yeah. So I want to body pizza na tseleng gore di lwantshana le the meds and whatnot. You know, how is it that the department can mitigate it against such factors?
No, ke meeting fela ke go bua go di meeting tsa bone tsa department di THPs. Gore no, let's work together. Ha ba khona go lemoga dipitsana dingwe tse sa bereke maybe hantse go ya re le go nna le bo di studies research ga se le no di a checka di muti tse le gore no maybe di na le a negative drug interaction what we are having on board the ARVs or STI treatment
ene le bone self-esteem ka ba rutana di treatment ba rutana from national e khona go na le batho ba tema ba berekang ka THP from Department of Health.
Okay. I know, that's great. It means that there's a common goal shared between department and the THPs.
Yes,
okay, no, that's great stuff. Any other information that you'd like to share with the listeners out there?
And the information February month, as we know, is a Valentine. We promote condom assembly.
Ntse rata condom. So promote condom.
Promote condom Ntswaki. Yes, as you were saying, Ntswaki, Valentine's month, the condom ari bereke. Right? We tebe tse no go shebile phone.
Are go tsa di condom.
Re bontsha eng do no ja di perekisi during the break. No, it brings us to the nutrition side of the ntho tse tsamaelanang le bo STI and whatnot. Can you just give us some information in terms of what a person who is infected with something as serious as HIV and AIDS should be eating health-wise and whatnot, and how they can help the medicines that they are given at various clinics?
Okay. When it comes to nutrition, nutrition is very important, especially with treatment. If you're on ARVs, we encourage people on treatment to eat a healthy, balanced diet. I know most of the time when the moment re kala a healthy, balanced diet, people are thinking expensive. They think because the moment ukala healthy banana yo lettuce atura but we use what we have motlum, but as long as it's balanced and it's healthy, we encourage people to have vegetables in their diet, a lot of vegetables, and a lot of people baratanama. The moment ukala bua healthy, they think meat. So Leona, obviously we need to limit, but in terms of nutrition, we really look at supplementing as well. Because most of the time, Batubarona, then, especially when they start treatment, you find that they tend to have a lot of issues with nausea, vomiting, diarrhea, and that leads them not to eating properly. So we will then, encourage them, supplement them, give them something to help them, especially if they've lost weight. But healthy eating, you can use what you have in the house. You just need to make a correct choice. It doesn't have to be expensive. It doesn't have to be. You find a person on ARVs and the only thing they have is papa le cabbage. it's fine, eat that, as long as you have something, because Kaunda medication, you need to eat something. So we encourage them to use what they have in the house, and we try not to stress them, unnecessary things, buy this, buy that. So use what you have, and just the way you prepare it, the way, the method of preparation is very important as well. But mostly healthy eating is very critical when it comes to ARV treatment and HIV as well.
All right, great stuff. Mr. Turi?
Matlosana?
Yeah, no, right, so no.
Yeah, no, like we are in February. Ke between Togo for STI prevention. So Tata Ribuaka STI, Ribuaka condom promotion. Not only promotion, Ribuaka condom distribution, where we are also going to demonstrate how to use condom. STI and then the Valentine. So it's on condom until the end of the month. So re-encourage about
even beyond.
And re-encourage about Tata le kuri kliniking tsa rona re kopa gore no motho o mongwe le mongwe o tsanang ko kliniking. Let's make sure this person we screen for STI. We are having STI screening tool. So you have to screen for STI because sometimes ba tle go tla ko kliniking le khanya gore no motho ga itse ena gore ka tswana le di signs tsa STI. Mara go ka screening tool. Ha o motsa go kry le gore ne go bofelong you find gore no this person is having STI symptoms. That's where you are going to treat and also advise the health promotion what to do and the prevention of STI. So the whole month is about STI prevention and condom distribution. Not only distribution and utilization.
Usage. How do you use
utilization?
So tomorrow they can join us as Matlosana Sub-District Tribunal Roadshow, Condom Roadshow, Kausaneko.
Don't know. I think that let's just give the dates. Let's give the dates because
it's actually the whole month.
The whole month.
Yeah.
There'll be activities. The whole month there's activities everywhere throughout Matlosana.
Because I think what we can do is throughout Matlosana, then you can just give like the different locations and let people know the information will be communicated in time for them to know hore.
But no,
just name the areas that you'll be visiting in Matlosana.
Okay.
Tomorrow we'll be at
I think
taxi rank.
We're going to also go into Kuma. We've got activities in Tihani. We've got activities in Kanana.
Joburton.
We've got activities in Joburton.
The farms.
And also we're going to go out into the farm areas as well. With we're going to give all services. Testing, people can test, screening will be done. All the services will be provided throughout, and there'll also be condom distribution. Menzwaki will be there demonstrating how to actually use the condoms.
Mr. Turi will be telling her she knows it from experience.
And we'll teach, especially when it comes to like female condoms, there's obviously those lists. So she will be teaching there in those campaigns that we'll be having throughout the month.
Okay.
So we'll be very visible throughout the month of February. They'll catch us wherever they are. They will catch us there.
Okay. Great stuff.
Yeah, we are working together with our stakeholders. Oram Institute, ISPS, Sort It Now, TB and HIV, Right to Care. You Right to Care ratatle. Yalwetsa.
Okay.
Yalwetsa yo. Won't it only luna ka bongata hle. Condom plus circumcision ke ntho tse ntle tseo kaofela.
All right.
Ready to air. Wherever we go, we've got that package.
Yeah, I think we must make time, really invite the stakeholders salon so that we've got the department, Right to Care, Shout It Now, all of them, so that we can have a conversation. Maybe at the conclusion of the activities STI month, just to see what effect the activations have had in terms of empowering people and giving them information. Letting them know how it is that they can, work around, being STI infected and whatnot. Okay, so I'll make sure that I get those contact details so we can invite them to the studio.
Stakeholders group.
All right. No. Okay. Thank you. Ladies and gents, thank you very much for visiting Fireside Conversation. Thank you for honoring our invite. It was short notice, but we made it work. To all our viewers out there, it's FYRSYD on all social media platforms. Fireside Conversations. You spell it FYRSYD. And then if you have any information that you would like for us to discuss on this platform, send us an information at info@fyrsyd.co.za. That's info@fireside.co.za. And then please like and subscribe. You know, that's how these things work. You know, it helps us build the numbers. It helps us generate a lot of interest so that people can get information. And we would like to thank La Floza Guest House in Klerksdorp for housing us. You know what? You must come and visit this place when you find time. It's an admirable place and you really enjoy yourself. So that's how we close it for today's conversation. We were talking about STIs. Thank you very much and God bless.